Hi, I'm Harrison Nguyen. I'm a dermatologist and clinical researcher from Houston, Texas. Let's talk about the DecisionDx-Melanoma test. What the DecisionDx-Melanoma test really helps us do is better stratify individualized risk for a patient's melanoma. It really provides two things. First is a patient's individualized risk of a sentinel lymph node biopsy being positive. Second is a patient's individualized risk of the melanoma coming back or the risk of recurrence. Let's talk about each one of those. And so the sentinel lymph node biopsy procedure, it's done typically for patients T1B or T2A and above. Now, sometimes that's helpful, but other times it may not be the right step for the patient. And so what we can do is that we are able to, with the DecisionDx-Melanoma test, we can integrate the clinical and pathological factors that we already rely on, things like Breslow depth, things like ulceration, and we integrate it with the tumor's genomic profile to create a patient's individualized risk for a sentinel lymph node biopsy being positive. That way, when I have that test result in my clinic, I can talk to patients. I can say to them, look, this is your risk based on your genetic profile and based on your staging of a sentinel lymph node being positive. Does this make sense for you? And we can talk through those percentages. We can weigh in a patient's other health risk factors, his or her goals, other types of maybe sometimes social factors that factor into whether we need to escalate care to have a more informed discussion. Now, the second thing, the second output is that patient's individualized risk of recurrence. Now, what that really does help us decide is it helps us decide how are we going to monitor our patients moving forward. Okay, and so let's talk through one of these clinical scenarios where I think it's so important for us to understand this, where if we didn't have this, there would be a gap. Here's a scenario. Let's say we send a patient off for a sentinel lymph node biopsy procedure. It comes back as negative. So this is what's called as a node negative patient. How do we monitor these patients? How do we screen and surveil these patients moving forward? In the absence of a genetic profile test, the only thing we have is routine surveillance with skin exams. That patient's being sent back to me as a dermatologist. We're following him or her every 3 or 6 months with skin checks and nodal exams. But how do we identify the patients that are already going to develop metastasis or going to develop recurrence beyond just the skin? We don't have a good way to stratify the patient. That's where I really lean into the DecisionDx-Melanoma test. I can identify the patients who are at high risk for recurrence. These are the patients that I'm going to not just follow with routine skin checks, but I will order routine imaging, such as a PET scan or a CAT scan, to routinely monitor for metastasis, routinely monitor for recurrence. We've seen studies in the real world that have shown that when patients have a high class 2B result, when they undergo routine imaging, that metastasis is detected earlier, recurrence is detected earlier, and these patients actually live longer. Again, this is a critical clinical scenario where I really rely on the DecisionDx-Melanoma test to be able to identify patients. So in summary, what the DecisionDx-Melanoma test, it helps identify a patient's individualized risk for that sentinel lymph node being positive, for the risk of recurrence, really ushering in the era of personalized care and personalized medicine in dermatology. Thank you.